So now we move on, and we're talking here about partnerships, pursuing strategic partnerships to push innovation, and a great pleasure to welcome Bertrand Audouin from the Vice President Global Health Initiatives from IAPAC, because actually we know that if we want to go, what do they say, if you want to go fast, go alone, if you want to go far, go together. So, partnerships, where do we go? Bertrand.
Okay, thank you. Good afternoon, everyone. So, I'm the other vice president at IAPAC, and I will take you back to what we discussed yesterday morning, and basically don't give you a lot of data, but tell you the story of how we want to try and help translate global objectives into local action, if we can. So, to just give you a bit of background, I've been with IAPAC 3 months. I worked in a French HIV NGO from 1996 to 2011 called SIDAction, where I supported, I didn't, but we supported a lot of local NGOs in both Eastern Europe and Asia and Africa. And then I worked for IAS from 2011 to early this year. So part of my job at IAS was to help organize the International AIDS Conference in Washington. And being French, I came to Washington thinking that USA was this big, rich, wealthy country that would show us the way in many ways. And then I saw what we've all seen in the past 1.5 days, which is the HIV treatment cascade in the USA. And I might have been naive, but that was a surprise to me, because if you look at the French cascade, the last ratio is not 28% as it is here, but it's about 66% of people being virally undetectable. So I was wondering what was happening when at the same time a lot of the American friends who were helping organize the conference were pushing for an AIDS-free generation and talking about an AIDS-free world. And I started wondering how that could happen, even in a country where 28% of people were undetectable. And then I saw, just a few months ago, I don't know if you can read the one to the left, The Advocate, the title basically says, "Welcome to San Francisco, the first ever AIDS-free city in the world," okay, which speaks about the public commitment that has been made by the city of San Francisco to be AIDS-free, by 2020. And then I read the public declaration from the governor of New York State, end of June, saying basically that he also committed for New York State to be AIDS-free by 2020. And I thought, if they can do that, can we also do that somewhere else? Can we also target other cities and see if they would be ready to commit to the same kind of objectives and targets? So we tried to be a bit more granular. We went down into trying to have a look at local cascades and city cascades. We got some here from US cities. You have Chicago and Los Angeles, Philadelphia and San Francisco here. So you do have city cascades in the USA. And you have the main tool you need when you want to start working about what it would take at the city level to achieve an AIDS-free city. Then if you look at Europe, there is no city-specific cascade yet in Rome, no city-specific cascade in Paris, none in Stockholm. There is one in Amsterdam. If you go to Africa or Asia, about half of the capital cities have city-specific cascades, the other half doesn't. So we already miss data that we do need if we want to discuss with cities whether they would be ready to commit to being AIDS-free in the near future. So from that, we looked at the big global targets and big global commitments and key successes that global organizations are talking about at the moment to see if we could help translate them into local action. So key elements for success, I'm just reminding you of things we heard yesterday from Deborah Burks, from Michel Sidibé and others, saying that we need to improve delivery system, that we need to improve proximity, that we need to foster innovation. That's all true and fine. You look at global priorities. PEPFAR is talking about doing the right thing in the right place at the right time. UNAIDS, Michel yesterday talked about prioritizing, talked about building local scenarios, and talked about not missing the window of opportunity we have between now and 2020 to start new innovative projects and partnerships. And I will remember that sentence because I think it is very important. And you also heard him say, we can't do everything everywhere. And if UNAIDS cannot do everything everywhere, IAPAC can even less do everything everywhere. So we do need to focus and make choices. So looking at cities and at the examples of New York State and San Francisco, if you look at very basic global statistics, a majority of the world population today lives in urban areas. That wasn't the case 20 years ago, even less 30 years ago when the epidemic started. 60% of people living with HIV in the world do live in urban areas, and half of them, so 30% of the people living with HIV in the world live in one of the 220 biggest cities in the world. So if you do focus on this list of 220 cities in the world, you are targeting 1/3 of the people living with HIV in the world. This is a kind of focus. So this is all provisional. As I told you, I've been with IPAC 2 months. I'm developing that, and we will welcome comments, questions, suggestions all the way. Not only now, but in the next 10 years. What is new in the kind of partnership that we want to build? First of all, is that it will be a UNAIDS and IAPAC partnership, and I think it is quite unique. And Michel told us yesterday that he sees that as a potential game changer in the way UNAIDS does some of its work, and so do we. We see that partnership with UNAIDS as really crucial and really key to the success of the initiative. We want to involve mayors and city governments. We won't go to cities where there will be no political will from mayors or city governments to change the way they do business. We want to work, of course, with affected communities and civil society. I'm saying that because you know IAPAC is an organization of AIDS care providers, and now we're very aware that if we want to really help change the situation in some of these cities, we need to have the civil society and NGOs in the room, and we probably need to have a majority of civil society in the room, I would say, but that's my personal opinion. We need to involve local healthcare workers at all levels. We need to have doctors, we need to have clinicians, we need to have nurses, we need to have pediatricians and gynecologists in the room. They're the ones delivering care and support and treatment, and they need to be part of the game, of course. We need to have public health experts. Badara Sam just talked about the amount of expenditure that we will need in the next 15 to 20 years, and how universal access to treatment will decrease the amount of money that will be needed at the global level. This is also true at the local level, but we will need to be able to demonstrate to political leaders and mayors that investing in universal access now is a smart investment. And you know, they look at the next election and not at 2025 or 2030. So that's the kind of partnership that we want to build globally and locally. We have worked on 6 principles so far. We don't want to have too many, but we, again, are very aware that they might change in the next few months. What we will ask from mayors and city governments before we start working with them is that they are ready to improve targeted combination prevention at the city level, working on an evidence-based basis. that they want to do increase testing rates and early diagnosis in their cities. This is not, there's not always a political will, or it's not always seen as a political priority, let's say. We want political leaders and officials to recognize the role of specialized and of primary care healthcare workforce, and the role of communities and civil society. We don't want to have civil society people sitting in the room to just sign on a declaration on the last day of a 3 days meeting when they haven't been part of the discussion. We want all stakeholders to be part of each discussion. We want to build, and we want the mayors to commit to building an enabling environment in their cities, which means that they will commit to fighting stigma and discrimination. That could be, as you are well aware, an issue in countries where anti-gay laws are coming back into the picture, like it did in Chad just 3 days ago. So that will take some kind of strong political will from mayors and their teams in many countries. We want them to acknowledge the shared responsibility that, yes, the mayors and the political leaders will be held responsible for part of the outcomes and the results. And we want them to be ready to implement effective monitoring and evaluation systems. We don't want them to just sign on a declaration. We want to be able to report on progress made every year and to adjust the programs accordingly. So these are the 6 principles we will submit to mayors and their teams in the coming weeks and months, with 5 global objectives. I guess you can't read them at all, but so these objectives are inspired by the work we've done with our colleagues at UNAIDS in the past weeks, and really building on the 90-90-90, which is a strategy we strongly believe in, and which is why we went to UNAIDS asking them if they would be ready to partner with us on this program. So you have the 390 there. You also have an objective on reducing stigma and discrimination again. We want to work on human rights and the law in each cities we will target. And again, a strong objective on increasing combination prevention services. So we will talk about access to care and treatment, but we will also talk about getting a universal access to more traditional prevention mechanisms. You got me. So again, who do we want to be on board at the global level? If we want to succeed in that program, we will need to have an array of partners. We can't do that alone. We even cannot do that with UNAIDS alone. We need to have global civil society and human rights organizations joining us and designing the whole initiative and concept. We need to have professional associations. We need to have the International Council of Nurses. We will need to talk to medical associations, and we will need to talk to them about task shifting. We do need to talk to implementing agencies such as PEPFAR and others. We will need to talk to research institutions like the NIH or the ANRS in France, and we do need to talk to the corporate sector. So we've started doing that, of course. But again, it's a work in progress. We need to build a strong partnership around that strategy. So what do we want to do, and how do we want to do it concretely? We want to start with a local consultation in each of the cities that will tell us that they would be ready to join the initiative. So we want to have a 3 days consultation in each city with the city officials, with the public health officials from the city, civil society, care providers, people living with HIV, and 1 or 2 persons from IAPAC, 1 or 2 from UNAIDS. But we want the consultation to really be local. We want the people locally to look at their local cascade and discuss together what it would mean for them locally to talk about their city being AIDS-free. What does that mean to them? What data do we miss to make sure that we will make progress in the right areas in the city? Who is ready to do what will be a huge issue and different from one city to the next, but we need to have a clear distribution of roles and of the task force. And of course, the most important thing will be to identify local priorities looking at the data. What is the most urgent step of the cascade that we should work on locally in the city if we want to achieve quick progress in the city, and what would be the obstacles and the barriers to making progress. Okay? So this is the first step of the local level. From that, we want to try and build a global consensus with 3 meetings, 1 meeting with health officials and mayors from high-income countries, another one with health officials and mayors from low and middle-income countries, and then a global meeting with all of them where we will try to translate local objectives into a global one that will be as aligned as we can to trying to reach AIDS-free status in the cities. Okay? But that would translate into different ways to do it in each city. Okay. This is a 10 years program. It goes from now to 2025 and might go beyond or might stop if I'm totally stupid. So we want to build, IAPAC is building at the moment what we call rapid response teams that will be regional teams that will be ready to be deployed to the different cities that will be part of the initiative to help coordinate and support the local task forces in making progress on their priorities. And of course, we will work with UNAIDS offices in the different countries that will be part of the initiative. We want each city to have an annual local progress report that we will build into a global progress report, but we want to document the kind of progress that we will make every year, and we also want to document the failures, because we will also learn from the local failures, I think. So we can yearly adjust the local or the global programs from the progress reports we've had. And the ultimate target will be for the cities to reach an AIDS-free status, as New York and San Francisco have already committed to. So, as I told you, this is a work in progress. Okay? The list of implementing and technical partners, we are identifying them. I am starting having discussions with people. The #1 list of potentially selected cities and participating cities is being selected at the moment. So I have reached out to a number of cities in Europe and North America and Australia, including Amsterdam and Paris and Rome and Barcelona and Denver and Chicago and Vancouver and Sydney. We also want, of course, in the next few months to reach out to cities in South America and Africa and Asia. We have an endless list of cities at the moment that we need to explore and build down to a short list of cities. And the time frame, again, is still in progress. When I started working on that initiative in July, we had an objective to launch it on World AIDS Day this year. And then I saw that I was no Superman. So at the moment, we are considering probably end of March, but really we'll do it when we are ready. The thing is, we don't want communications to come first and then see how we can translate into local programs and actions and commitment. We want to do it the other way around. We want to make sure that each city that will commit to being part of this initiative will come to the initiative knowing how they can do it and what are their obstacles locally, which is why we will start with local consultations. And I was very happy to hear Benjamin say that good is okay and perfect is not necessary. So please apply that to this initiative. Okay, so in short, what we want to do, and I think it does speak to what we heard yesterday morning, we do want to focus, we do want to go where the needs are, and when the vision is there, where we will find local organizations or even if weekend mayors who have the vision of how to make their cities AIDS-free, some of them do. We want to build on global strategies and objectives set by international agencies. We don't want this initiative to be completely cut off from global objectives and strategies. Wafa yesterday morning said we need to break aspirations into operations, even if it's very hard to say when you're French. I totally agree with that, and that's what we will try to do with this initiative. We want to be flexible, we want to work with communities, we want to use the science. This has all been discussed in the past day and a half, but really we see that initiative as a way to try to not only say we need to do it, but try and do it locally. Badara Samb yesterday said we need to bridge the gap between HIV stakeholders and politicians. We see it as a way to try and do it again. And I would say we need to think globally and locally, and we need to act locally and globally. So to sum it up, this is, to me, very new. I got very scared in the last week because everyone I've been talking to in the past 2 months about this initiative has either been very nice to me or very honest, but most people are ready to discuss it, so I find it almost scary. But that's a good thing. And again, I do welcome your suggestions and questions, and if you're part of an organization or a city that would be interested in discussing it, here I am. Thank you.
Bertrand, thank you very much indeed for telling us about this very exciting initiative. I can say there have been conversations, preliminary conversations about, and even today I can say the UK as opposed to England, and whether there may be cities in the UK who may be interested in participating. So those conversations are beginning to happen in this country, which is very exciting. We have got a couple of minutes for a couple of questions. There are 2 hands waving, so one person there, followed by that person, then we'll see how much time we've got
the
left.
microphone.
Hang on, well, you've got the microphone. Hang on, this is unfair, harsh. Okay, you'll have to be very quick, so I didn't see you, and I didn't see you've got the microphone, so...
Yeah, okay, because Bertrand is asking for suggestions and recommendations, so I have 3. Good. But I'll try to be very concrete. First, that I really like the idea. It's not that I'm raising my hand to include my city, but it can be possible. First one is that we need a very clear and operational definition of what AIDS-free city means, because it can mean a lot of things, and people might think that it's an HIV-free city, which is not the intention. The second one, I think that in order to demonstrate rapid success on the AIDS-free cities as an example to be followed immediately, there needs to be an exclusion criteria. It's not that every city that wants to participate can participate. Many laws, criminalization, human rights violation do not depend on mayors. They depend on the country-level authorities, so they will be able to do little or nothing in order to skip those barriers. So I think those cities should be excluded if you want to demonstrate success in a rapid way. And the third one, I think all those cities, they need to start working immediately on their city cascades.
Okay, can I stop at this point? I think they're very good points. I think we'll probably all have masses of things we want to tell Bertrand. I'm not going to ask you to necessarily respond to everything. Can we just take the 3 hands, the person there with his hand up? Yeah. If we take the 3 questions, then we'll see whether there are answers or whether it's just a discussion. So,
hi, it's Peter Keogh from London. I really, really like the idea, but I mean, speaking from, for example, from our perspective in London, you mustn't forget that the majority of people living with HIV in London are actually migrants to London, and comparatively recent to migrants in London. And that's both, of course, the 2 communities that are most affected, African migrants to the UK and MSM, in fact. It's not a homegrown epidemic. So that's a kind of a good sign in terms of focusing on a city, but often migrants to the city are the people with the least capital and least investment on a citywide basis. And also cities can set themselves up as kind of citadels or kind of fortress cities in relation to AIDS-free city. I actually find that a little bit disturbing because in terms of migrants arriving into that city with HIV, it doesn't send out a very good message. But I think you need to, think about migrants and diaspora and the fact that most people living with HIV in London live in diasporic and global networks.
Thank you, Peter. And then the third hand was over there. That's it. Yes, she's waving.
Hello, I'm Elske Hornenberg from the Netherlands. Thank you for this very practical, pragmatic, attractive idea. Really liked it. I've had the privilege to work together with Joep Lange in the past year. And he had a similar idea that he wanted to apply to Amsterdam. And we actually have been starting up the last year with a HIV-free Amsterdam. We're working together with a community, with policymakers, with primary healthcare professionals, with hospitals. And I would be very willing to share our first experiences if that would be useful for the further taking off of this program.
Thank you very much for those 3 points. So what I suggest is whether you can give us a brief response to the 3 points we've heard and leave us with the way to reach you for all the other comments that everybody in the room is likely to want to have conversations with you. So we've got a couple of minutes here.
Okay, so very quickly, what does AIDS-free mean? I have my idea. I think if we ask everyone in the room, we might have 50 different answers. Part of the initiative is ask that question at the city level before we translate it into a global objective. I mean, we have our own idea. We think if we do follow the UNAIDS target of 90-90-90, that basically leads to an AIDS-free environment. But how that translates at the local level, as you say, will be key to the initiative, and that's a discussion that needs to happen locally if it has to make sense for the people on the ground and for people living with HIV. So that was my first answer about migrants and MSM. We have the exact same situation in Paris, so I know exactly what you're talking about, except in Paris it cannot be documented by law. It's against the law in France to have any data and statistics based on race or origin. So we know, but we can't document it. But this really will have to be part of the discussions as well. And I hear your point about the idea of AIDS-free not being necessarily welcoming to migrants. I hadn't thought of that, but yeah, that's something we need to take into account. And about Amsterdam, yeah, welcome. When I started working with this initiative, I discussed it with Joep, actually, in June. And I have been in contact with some of your colleagues in Amsterdam, but only some of them. So, yeah, I do welcome discussing with you, and well, that's exactly what we need. And how to reach me? Well, my email address is not there, but my email address is Baudouin, Baudoin, @iapac.org, and I have business cards if you need some. So
I suggest, could we ask the organisers to put Bertrand's email up over the tea break so that we can find you, and leave a stack of cards and ways of contacting you at the reception desk. Would that be a start?
Yeah.
Because I think this is an extremely exciting moment, and I'm sure everybody from whichever city you come from has got something that they want to contribute. So, Bertrand, thank you so much for a very exciting talk, and thank you for your ideas.